as the national capital has been gripped with the pollution related problems, what we have been seeing that air quality has been gripping from bad level to worst level and then from good level, right? And the Diwali has basically put an add-on effect to it. So right now we are at the RML Hospital, and we have with us right now Mr. Ajay Shukla, who is the director of this prestigious medical institution. So sir, what we have seen that you have taken a very good initiative, right, to start a pollution OPD. This is a very special kind of pollution OPD center. What is it? What is it actually about?
Well, basically, every year around the months of November and December, pollution peaks in Delhi and the surrounding areas. And because of that peak in the pollution, there's an increase, almost 30% increase in the number of patients who come to our OPDs for pollution related problems. So we needed a new OPD. And the other thing is that pollution does not affect only our lungs. It affects other parts of our body, and therefore we needed a comprehensive, a multi-departmental OPD which will be able to take care of all the different organs, parts of the body that are affected by pollution.
What would be the departments? I mean, like, could you please reiterate those departments' name?
Well, basically, the pulmonary medicine department, respiratory medicine department will be there, which will look after the lungs and the lower respiratory tract. We'll also have the ENT department, which will look after the upper respiratory tract, the eye department, the skin department, dermatology, and also the psychiatry department. Because when pollution levels increase, then people also have mood swings and sometimes even depression and other mental problems.
So how do you think, how long this facility will be available in the RML hospital?
Well, as long as there are patients who need it, because everything that the hospital does is for patients with problems. So as long as the pollution levels will be high, as long as people will continue coming to our hospital for this issue, we'll have this OPD. And in case the number of patients coming for this problem will increase, then we'll also increase the number of days that we run this OPD.
So basically you have started, took a unique initiative, right? Do you encourage other hospitals to take such initiative?
Well, pollution is definitely a widespread problem. It's not only limited to Delhi, it's limited to a lot of areas. It's spread over a lot of areas. So, and then the population of Delhi alone is very large. So just one hospital dealing with such problems is not enough. If all other hospitals will join, then it will be much better for the public.
As the pollution condition in the Delhi NCR region is very abysmal, right? What we have been seeing over the years. So how do you encourage common people, right, to basically take precautionary measures?
Well, basically, every individual needs to understand that inside their family, there would be certain people who are more vulnerable to the effects of pollution, like elderly people, like very young children, like people who've got some chronic lung diseases, people who've got cardiac problems. So all of them are vulnerable to pollution. So they should avoid stepping outside their homes. They should remain indoors. Even for young people, people who are fit, middle-aged people who go to work, well, they have to go to work or college. They can go, but they should understand that they need to curtail their other activities. For example, if somebody enjoyed running outside, somebody enjoyed cycling, somebody used to go for a brisk walk, they have to avoid this when pollution levels are high, because when you do a strenuous physical exercise, then your respiratory rate increases, and the number of pollutants that will enter your lungs and your bloodstream will increase many times in 1 minute. So you have to be careful, and it's not just that you feel that I don't have any cough, I'm not getting breathlessness, so why should I worry, I'm fit. So that is wrong thinking, because a lot of pollutants are carcinogens, and when they enter your body, they can trigger mutations inside cells, and then it can transform into cancer. So 10, 15 years later, you get a test and some doctor tells you, well, there's a cancer developing inside your body, and the reason was your exposure to pollution. So therefore, everybody has to understand that he is vulnerable to the effects of pollution, and he should take all necessary possibilities to avoid the adverse effects of
So
pollution.
what we have been told that this special OPD will be functional on Monday itself, right? So are you planning to extend it? How successful this campaign has been so far?
Well, sorry. So it's we've started it just once a week. It will be on Mondays. Between 1 and 2 we'll have the registration. Between 2 and 4 we'll have the OPD. If the number of patients increases, we will increase the number of OPD days also. It's just been 2 weeks. We started it last week. So it takes time for people to, become aware that there's a special OPD which they can access. So it will take time for people to start coming. And post Diwali, yesterday, day before yesterday, Monday, there was hardly any patient in any OPD in the hospital. Hospitals are usually very less crowded on the next day after Diwali. So it will take time. Let's see.
Right. So this was Dr. Ajay Shukla, who was speaking exclusively to Republic TV on the various issues, basically how he's basically planning to tackle the pollution-related problem in Delhi NCR region.